Thank you for joining me here today. I'm also joined by Erie County's Medicaid Inspector General, Michael Szukala. And we're here to talk about actions, investigations, and reports that have been performed by the Office of Medicaid Inspector General since it was created in September of 2012. Medicaid is a means-tested program and a lifeline for people who need primary and acute medical services but don't have the means to pay for it. As you know, Medicaid is Erie County's single largest program expense, and with the total cost for the county, the state, and the federal government of over $1 billion annually across the county. In 2013, for example, we now know that 225,000 people were covered by Medicaid in Erie County alone, which is roughly 1/4 of the entire population. So, as we know, a big program certainly has a very large potential for abuse. As comptroller, I spoke out that we need to go after and take a look at what could be potential Medicaid fraud, not only for individuals but for providers. And when I was comptroller, Michael Szukala, of course, was my deputy comptroller for audit, and we looked at a number of areas that we had the power to look in as comptroller, but we realized there was so much more that we could do if we actually had the power to do so. We did have it as comptroller. We wanted to go out and take a look at the loopholes to try to find fraudulent and dishonest actions that were being done by individuals in this community, not just recipients, but also providers who were bilking the system. Whatever the scale might have been, whether it's small or very large, theft is theft. Fraud is theft. It defrauds from the public, it takes the public's dollars, and it's using it for improper purposes. And we knew it needed to be stopped when I was comptroller, and as you may remember, when I took over as county executive, I said one of the things that we want to do is create a Medicaid Inspector General's office, which we did in 2012. And this is part of a pilot program through New York State that is being funded 100% by New York State. So there's no local share for this program. So the cost associated with Mr. Szukala's salary, his staff's salary, as well as the work that they do if they're going out and traveling is all paid for by New York State. And the reason why is because if we find any fraud, if we find any abuse of the system, not only do the Erie County taxpayers save money, but so does New York State because they contribute a substantial amount towards the Medicaid program. So, what have they done? Now, we are limited on talking about particulars of each audit because of confidentiality agreements we have, but we did want to give an update to the public on what they've done since September of 2012. In fact, the Erie County Medicaid Inspector General's office has completed 9 audits, reviewing over $51 million in Medicaid claims by providers. They're currently in the process of completing 4 additional audits, reviewing an additional $12.5 million of provider claims. As part of this review, they have identified over $320,000 in potential provider overpayments that we believe are eligible for recovery. We now, under the rules that we have with New York State, have turned over those findings to New York State's Medicaid Inspector General's office, and they are in the process of going forth and determining whether recovery should be obtained, and if it's a substantial amount that they think that this is a continual pattern with the parties potentially turning this over to the New York State Attorney General's office for criminal charges to be filed as well. Now, as part of the program, it's not just that we take a look at providers who might be bilking the system, but we also receive tips on individuals who may be bilking the system, recipients who are trying to take advantage of the system to receive Medicaid payments. And just in the last couple months alone, we've identified and sanctioned over $127,000 in fraudulent payments or claims for just a couple individuals alone. This means that these individuals will have to pay for all claims associated with their health care out of their own pocket before the Medicaid system will cover it again. So what you see are individuals who are trying to hide assets, who are out there who truly shouldn't be on Medicaid because they have a substantial amount of assets trying to take advantage of the system. And we've identified just in one case alone where it was almost $100,000 alone from the one individual. And we got that information through a confidential tip that was sent to our office. And this is the stuff that the Medicaid Inspector General's office does in addition to looking at providers. because it's important for the public to understand that we want them to know people are out there watching. But we also want the people who are trying to take advantage of the system to know we're watching, and if you continue to do this, we're going to find out about it, and we're going to go after you. We're not going to just stand by and say, well, that person is taking advantage of the system, and we're going to turn a blind eye to it and just walk away. We're not going to do that. We are going to go after individuals who try to take advantage of the system. So over the last 15 months, the Medicaid Inspector General's office has been pretty busy with a lot of work. As you may remember, they issued the comprehensive report on Medicaid usage in Erie County in 2013, which looked at the number of individuals that receive Medicaid, what it's being spent on, the demographic breakdown based on age and race. So this is the kind of things that they're doing to take a look and seeing how are we spending our Medicaid dollars, and are we doing it inappropriately. So it is fair to say just in the last year alone, approximately, there's almost been $500,000 between inappropriate payments that we believe were made to providers, and another 127,000 that was made particularly to or received on behalf of recipients that weren't eligible to it. I mean, it's $500,000 nearly in total savings that this office has come up with in the last year and a half, which truthfully pays for the office's costs many times over for a number of years. So at this time, I'd like to introduce to the podium our Medicaid Inspector General, Michael Szukala, and just give a little bit more of a breakdown on how they go about their audits. Sometimes they find things, other times they don't. If they don't find things, that's actually a good sign. That means that the providers are not trying to take advantage of the system. But they have found things that lead us to believe that some providers are trying to take advantage of the system, and that's the information that we turn over to the state. So Michael, you want to talk about the process?
Thank you. Yes, as the county executive said, my name is Michael Szukala, and I'm the Medicaid Inspector General here for Erie County. A typical audit process begins with the selection of an audit target. In many cases, this is very complex. We can either be given an audit target by Albany, since Albany funds us, and we take their recommendations very seriously. If they recommend that we perform an audit, we do so without question. Also, I'm a member of the Erie County's law enforcement, well, actually it's called the Medicaid Anti-Fraud Task Force. It's a group of law enforcement agencies that meet together once a month to talk about Medicaid and Medicaid fraud. Occasionally, something will come up at these meetings, and it'll be referred to me, and we'll use that as guidance for performing an audit as well. We also do our own analysis in the office. My team has access to the New York State Medicaid Data Warehouse. We are the only county employees that have complete access to it. It is the computer system that has the real-time Medicaid transactions on the system, on New York State's Medicaid system. And as a result, we can look at that data and look for trends or look for unusual transactions, and that too may drive what audits we choose to pursue. Lastly, tips. We do get them. People call in my phone line. My phone line, by the way, is 858-4639. It's area code 716. Or some people even stop into my office, and you're welcome to do so. And some of those tips do pan out. Once we've selected an audit target or targets, those targets are sent to Albany for review. There are two issues. Target can't be done recently. Albany will sometimes be aware that something was done and we weren't aware of. Or an audit target that we choose cannot be under investigation by another entity. So if we're doing it, it means that other agencies, let's say Albany or the DEA or the FBI, wouldn't be pursuing those targets. At that point, Albany generates an entrance letter, sends it to the auditee. They give us the data that we need to look for. They'll pick the samples. We'll have an entrance conference with the auditee. In general, we have this at the place of business of the auditee. We discuss the records that we need and the audit process. We try to be as inclusive and as upfront as possible about this. We'll then make arrangements to scan or copy the records that are needed. This generally is disruptive to the business, but we try and make it as quick as we can. Generally, we try to do it in just a day. We have the equipment necessary. We can scan in whatever documents we need. Then we leave. We return back to the office, and we do our analysis. And this is the most time-consuming and technically demanding part of the audit, where we'll look at the documents that were selected, and we'll make sure that if, for example, we did a pharmacy, we look to make sure that the scripts were performed according to New York State Department of Health regulations and other regulations that we've been trained on, and we perform our analysis. At the end of that analysis, we forward the documentation and any comments we have to Albany. They review our analysis. They'll often also look at the documents that we've selected to confirm that we did the project, we did it correctly. And they'll confirm our analysis, ask us to develop a draft report, which we'll do, and then we meet with the auditee. At that time, they have a chance to see what it is we found, what it is, they have any questions, we answer those. They have a chance to respond. We don't just spring things on people. Yes, at an exit conference. That's essentially what it is, an exit conference. And then at that point, they have 30 days to respond. They can either reject what we found, they have opportunity to provide additional documentation, or they can accept our findings. And if our findings include some kind of restitution, that would be addressed at that time.
What we're looking at when we perform these audits are providers of services, not just individuals. And to give you an example, during these first 9 completed audits and the 4 that are ongoing right now, we've looked at pharmacies, we've looked at transportation services, we've looked at durable goods providers. Because you would be shocked sometimes to see the millions of dollars that can flow through just one pharmacy. And it's important that you go in there and you actually see to ensure that they're doing things correctly. As I've noted, just in 13 audits, we've literally looked at $63.5 million worth of payments that were made in just 13 audits. Remember, there's $1 billion that's spent in Erie County alone annually. We're never going to be able to look at every payment that's made, but we do have the ability to go out there and look at specific ones, which I think is very important, because remember, if people know that someone's watching, there's less of a chance for fraud to actually occur, because people aren't going to take the chance if they know someone's out there watching. Truthfully, for many years, no one was really watching providers. And that's why we thought it was important, and I thought it was important to create the Medicaid Inspector General's division. New York State agreed. They stated that it's not a bad thing to have a county like ours doing this high-tech analysis to help them, because they really weren't doing as many audits as they like to have done in the Erie County area. With Mike being on the Medicaid Anti-Fraud Task Force, he not only works with New York State, he works with the FBI, the DEA, other Medicaid analyses, like Niagara County has a small office, to kind of figure out ways that we can go about this and truly catch the bad guys. You've heard of stories across New York State where millions of dollars have been recovered from just 1 or 2 pharmacists. We haven't found millions of dollars yet, but we certainly have found what we believe to be overpayments. As we said, over $320,000 in overpayments to providers and an additional $127,000 of improper Medicaid payments received by recipients. That's not that bad, $500,000 in basically 18 months that we think was inappropriately paid for, and truthfully the people of this community should get an opportunity to get back. So we're going to continue to do the work in the Medicaid Inspector General's office, following proper audit protocols and practices to ensure that the audits that we do meet the highest standard and level that exists. And as we do that, we are going to find ways to save taxpayers' money by keeping the bad guys on their toes and catching fraud in the act. And if by chance we don't catch it because we didn't look at one particular audit entity, they should know that maybe we haven't caught you yet, but we're going to find out eventually, because it's going to come time when we go through and have an opportunity to look at many more providers in the long run. So we're out there, we're doing a lot of work, we continue to do a lot of work, and I want the people to know the WBFO's mic just fell down. But more importantly, I want the public to know that they can be rest assured that there are individuals in this community who are out there. I think it's okay. There you go, just leave it. For the public to know that there are individuals in this community working on behalf of Erie County and the state of New York who are out there on a daily basis to go after this type of fraud that we previously didn't look at. And we're finding it. And to providers who may be trying to take advantage of the system, we're going to find out eventually. And when you do, you're going to be held accountable.